Well, it finally happened. After months of Republicans insisting they're not going to cut Medicaid, late Sunday night, they dropped their budget plan, and surprise, it slashes $715 billion from the budget and cuts healthcare from 13.7 million people. Yep, Medicaid as we know it is officially on the chopping block. I'm Mimi, and I'm here to talk about what these cuts really mean for the people who rely on Medicaid to survive. And let's be clear right up front. The real goal here is not about efficiency. It's not about rooting out waste, fraud, and abuse. The goal here is fewer people on Medicaid. So how do Republicans plan on getting there? They plan to make it harder. They plan to make it harder to apply. They plan to make it harder to stay enrolled. And they plan to make it harder for states to administer Medicaid. They also want to make it harder for providers to get paid. So let's talk about just two of these options. The first thing is that Medicaid recipients would have to prove their eligibility twice a year instead of just once. This sounds small, but for people who are already struggling, elderly folks, people with disabilities, those with limited access to technology or support, that's a huge barrier to have to do this twice a year. It's twice the complicated paperwork. It's twice the deadlines that they have to meet. It's twice the chance of losing their health care for just making a small mistake. In Wisconsin, we already have 1,400 state workers who do nothing but verify people's eligibility to be on Medicaid. We know that people aren't gaming the system. In fact, when a similar proposal hit our state legislature recently, backlash was so fierce that Republicans pulled the bill almost immediately. A second proposal on the table is community engagement. That's a nice sounding name for work requirements. Under this plan, non-disabled adults without kids would need to work or volunteer 80 hours a month. Sounds great, right? Here's the thing. 70% of Medicaid recipients already work. The rest are caregivers, seriously ill, or legitimately exempt. This is a solution that's in search of a problem. And it's an expensive solution. Wisconsin's Department of Health Services already looked into this proposal and found that administering work requirements would cost $66 million a year. And 52,000 people would lose coverage in our state, not because they didn't qualify, but because of red tape and administrative errors. So what's really going on here? We're gutting Medicaid to pay for tax cuts for the wealthy. For people who will never lose sleep, wondering if they can afford to see a doctor. If this budget bill passes, the Congressional Budget Office says 8.6 million people could lose coverage. Some estimates are 13.7 million people. That's over 12% of all Medicaid recipients, including up to 261,000 people right here in Wisconsin. When people lose coverage, they delay care. They wait until the last minute. They go to the ER instead. This raises costs for everybody else. And that's $715 billion in cuts. That's going to close down clinics, hospitals, providers. It's going to cut off care for entire communities, especially in rural communities where healthcare is already scarce or struggling. The bottom line is that this isn't about fiscal discipline or fraud detection. This is about chaos and cruelty so that billionaires can get tax cuts. The Energy and Commerce Committee, they just passed their budget proposal right now. The next stop is a full House vote, and the Republicans are going to pass it. They have the votes. So what do? So please call your congressperson, email your senator, make sure that they know we're watching and that we're not going to forget how they voted the next time that they're on the ballot. Send a clear message. No cuts to Medicaid. Not now, not ever.